Alrighty, good morning, everyone. Thank you so much for joining us. I am so excited to introduce this great advocacy webinar to all of you and our friends in the state of Texas. I am Caitlin Bracken, and I am the Director of Field Development for Houston and Louisiana. And I am just excited to welcome you all to learn about this great information that's going to be shared with you. Now more than ever, state and federal advocacy efforts are critical to the Texas autism community, and we appreciate you guys joining us to learn more about recent developments in not only Washington, D.C., but most importantly, our great state of Texas. So as most of you know, Autism Speaks has a wonderful new mission statement as of a couple years ago. We are dedicated to promoting solutions across the spectrum and throughout the lifespan for individuals with autism and their families. We do this through advocacy, which is what we're all here today to learn more about, increasing understanding and acceptance of people with autism, and advancing research into causes and better interventions for autism spectrum disorder and related conditions. So I have the pleasure of turning this over to Judith, and you guys are going to hear some more great information today. So thank you again for joining on behalf of all of Team Texas, which includes myself, Catherine in San Antonio and Austin, Erica here in Houston with me, and Maria in Dallas-Fort Worth.
Thank you, Caitlin. It's so great to be with all of you today. It's been a challenging time, I know, for everyone in Texas during this time of pandemic, lots of confusion, lots of disruption of services. And so today, our Autism Speaks advocacy team just wants to reach out, connect, and talk with you about advocacy that's taking place federally and on the state level. As many of you know, you're living this experience as people with autism, as providers. I know there are many providers that participate in these events, as family members, siblings, parents, as teachers. There's just so many unexpected experiences going on right now. School is closed for the year. Day programs are closed. The clinics that we frequent are closed. We've all been shifting to telehealth, which is a really new experience. Sometimes it's great, sometimes it's really challenging. Mental health supports are needed for parents, also for siblings, people with autism across the board. There's a lack of connection to those regular community supports that we have. And when you think about community supports, I'm not talking about just the official ones, but I'm talking about, you know, being able to go to church on Sunday, or many of you know my son Jack loves to go to Outback Steakhouse every Saturday night and eat wings. And so we haven't been able to do that. You know, he's used to being able to every Saturday walk in the doors of the Outback. They know his order, they know him, and he just has built a connection with them over the years. And he's not seeing those folks. Yes, we do go pick up to support the restaurant, but we can't go in. So it's just not the same. And those little losses are building up. There's disruption of employment for people with autism, and they work so hard for these opportunities. They deserve these opportunities. People with autism are great employees, and those opportunities are not happening as much right now. Respite programs are so needed. Autism is 24/7. We've heard a story recently in Georgia where a mom showered at 10 o'clock at night, and she had a son with autism who needs a lot of attention, needs support and supervision. And while she had just slipped in the shower quickly late at night, he slipped out of the house, wandered away into a really dangerous situation. And unfortunately, it was a tragic ending. So, you know, we talk about these things, as I've mentioned before, little losses. They're not. I mean, they can compound into tragedies. That 24/7 lifestyle is hard, and respite is so needed. Routines are lost. Loss of income for families has been devastating. People, even in day-to-day life, but even more so during these times, can have experiences with challenging behaviors, self-injurious behaviors, aggressive behaviors, and that's really hard to talk about sometimes, but it's a reality that our families are living with. And then of course, there's the whole fear around access to healthcare right now. What does that look like for people with autism? Can they have a loved one with them if they have to be in the hospital? These are really frightening, unsettling times. So we try to make sure that these types of issues really inform the advocacy that we're trying to engage in. And so I want you to know we care. And if you have other additions to that list, please feel free to share them in the chat box. I will share that you're all muted today and your videos are off just to save sort of bandwidth as we present this information to you. But please, you can put questions and comments in the chat box or the Q&A, and we will do our very best to answer those that we can. If your question is super individual, and I know a lot of times we have those, please feel free, you can put it in the chat box, we'll try to answer, or you can contact our autism response team. We have an amazing autism response team. There is a number with someone available who speaks Spanish that you can see on the slide, or you can email us at help@autismspeaks.org. So just know that whatever questions we don't get to on the webinar today, please feel free to reach out to the autism response team, and we will of course reach out to you too. If we don't get to your questions today, we can respond to those that are in the chat box later. Thank you so much for bearing with me during that long introduction. One more thing I want to mention is this presentation and a recording of it will be made available to you after the webinar is over. So don't worry about scribbling down a lot of notes. We're going to send it out to everyone. So just stay tuned for that. And please feel free to share it. We want to get good information out to our autism community in Texas. All right, so today we've already had our welcome. The first thing on the agenda is going to be a federal update, so we can talk about what's going on in Washington, D.C., what's happened over the last few weeks, what we can expect. I'm going to talk to you about state advocacy in Texas, and then we're going to talk a little bit about community outreach and the resources that Autism Speaks has compiled for our autism community in Texas that we want to make sure you know about. So without further ado, I'm going to turn over to someone many of you know, Angela Lello. So Angela, if you would talk with us about what's going on federally, we would so appreciate it. And then Angela will answer a couple of questions at the end of her section. So stay tuned as well.
Yeah, well, thank you, Judith. I'm so glad to be here with y'all. Judith mentioned I'm part of our federal advocacy apparatus here in DC. But before I came out to DC, I spent some time in Texas, and I feel like an honorary Texan, although you know, I do miss it and wish I was there with y'all. So I just wanted to go over real briefly the status of federal coronavirus response legislation and sort of where we were, where we are, and where we're going. And pardon the barking dog in the background, you know, this is real life, right? He was fine up until I unmuted myself. So just one second. Okay, Congress has been responding to coronavirus in a number of different ways and through a number of different pieces of legislation. And the first was passed on March 6th. And March 6th was really an appropriations bill or a spending bill. And that's where Congress just basically created a bunch of funding and emergency preparedness funding for federal agencies to respond to the emerging public health crises. Then pretty quickly thereafter, March 18th, Congress passed the second of what we are referring to as COVID bills or COVID-2. And that's the Family First Coronavirus Response Act. And that bill created emergency sick and paid leave for people who've been affected by this disaster, either because they are sick, they're caring for someone who is sick, or they are they have their child care arrangements disrupted. And you know, in particular, I want to note something about the paid leave with this. The way the statute was created, it created paid leave for parents who had children whose child care was affected and closed. And we, along with a number of other organizations, commented to the Department of Labor saying, hey, you know, there are parents of adults who attend day programs that have been closed, and now they must also care for those adult children. And so fortunately, we were very happy that DOL issued clarification that this paid leave would be available to parents of adults whose normal source of care was also disrupted. So we were very happy with that. The COVID-2 package also provided for a small increase in Medicaid funds across the board. It didn't target all of the Medicaid services and systems that need sort of a boost to deal with this emergency. But we're hoping to be able to do that in future packages. On March 27th, Congress passed the third of its coronavirus response bills, and this is called the, just a second, buddy. So that's one of my children who is out of school here. Anyhow, sorry, the CARES Act, what does it do? It provides a bunch of funding for economic impact payments. Some of y'all might have heard those referred to as individual stimulus payments. So if you've received a $1,200 check or $500 for your dependents. It also provided a few other things that are particularly important, including billions of dollars to address the public health response. And these are funds that are going to providers, healthcare providers of all stripes. And then there was also small business assistance in the form of a payment protection program and other sort of small business targeted relief. There was also, and Judith will talk a little bit about this when she talks about her state advocacy efforts, but there was a relief fund created for schools. And this was both for K through 12 elementary as well as colleges. And there is billions of dollars that are going to local school districts. And then the governor of each state is also getting several billions of additional dollars to help address emergency education response. And Judith will talk about how our advocacy will be focused to try and make sure those funds are going to students with autism. And then on the next slide, I want to talk about sort of the latest thing that has passed, which folks have been referring to as COVID 3.5. And essentially what that was a sort of stopgap bill that Congress passed to just replenish the small business program. There was a lot of requests for assistance in that small business program, so much so that it ran out of funds. And so April 24th, Congress just passed a quick bill to replenish everything there and make additional funds available to the small businesses who weren't able to get in the first round. They also addressed a few more funding shortfalls for healthcare programs, but the majority of work remains to be done in Congress for what we in DC are calling COVID 4 and/or 5. Basically, Speaker Pelosi has said that Congress is working to respond to the emergency in sort of three ways. The first was emergency response, and that was your very first, we're sending billions of dollars to the public health crisis response. The second two pieces of legislation were what Speaker Pelosi said were Congress's efforts to mitigate this disaster. And I guess 3.5 would also fall in the category of mitigation. So let's tie off the bleed, help it to stop bleeding. But then Speaker Pelosi has said Congress is going to pass future packages that will help recover. So this COVID 4 and 5 is what Pelosi and congressional leadership are referring to as Congress's effort to help recover and help sort of start the recovery from coronavirus. What is going to be in those packages? Well, it still remains to be seen. The timeline also still remains to be seen. I had heard that we might see a bill yesterday, today. We do know it's starting in the House, and then it will go to the Senate, and there's a lot of question as to whether or not the Senate has an appetite for doing an expansive coronavirus legislation or just a more narrow targeted relief to some key sectors. So potential items that could be in these bills include additional money for the public health response, additional economic relief, both for individuals and small businesses, money for state and local governments, money for education, additional funds for things like food stamps, housing assistance, the post office. And then also there's been lots of talk about including additional funding to shovel-ready infrastructure programs that could help get our economy and our country back on the path towards recovery. But that's what we've heard. However, Autism Speaks has been pushing some specific priorities. And Judith will really highlight how these priorities look at the state level, but just there were sort of a few things of note. One is that we wanted to make sure dependents, adult dependents, are going to be able to receive these economic impact payments. There was an issue related to SSI recipients and whether or not we were going to be able to get those direct payments immediately and automatically to those. We have been concerned about the distribution of education dollars, and Judith will talk about what that looks like and how we've been working to make sure that goes towards student with autism. And you also probably heard about this IDEA waiver report, which Secretary of Education Betsy DeVos was required to submit to Congress. And essentially, she said the United States Department of Education does not need a waiver of the federal Individuals with Disabilities Education Act. She said that, you know, there are some flexibilities around dates and timelines that need to be granted, but that does not mean we need to waive students' rights. And we, along with many other disability advocates, were very pleased with that report, and we continue to fight to make sure that IDEA isn't eroded in future coronavirus response legislations. We were also very pleased, as I mentioned, to see the Department of Labor clarify that emergency paid and family leave apply to parents of adults. So for our priorities, and as we go forward, on the next slide, it kind of highlights our main sort of asks for the next coronavirus response. Number one, and these are in no particular order. Number one, additional funding for home and community-based services, and additional funding, number two, for educational needs for students with autism, IDEA funds. So not only do we want additional funds for HCBS to help the system deal with the needs and increased capacity that the system is sort of struggling to meet, we also want to make sure the education system has the resources it needs to respond to these additional needs that will arise because students have been impacted and without services for so long. At the same time, we want to make sure that those adult dependents over the age of 17 are able to get these stimulus payments. We want to make sure that any additional emergency paid leave, whether it be sick or family, is accorded to caregivers of adults as well as children. There's been talk about expanding these leave policies, and we want to make sure that our community is benefiting from these new policies as well. And then, you know, another important sort of element of our advocacy has been focused on telehealth and making sure that payers are covering telehealth, whether you're in TRICARE or federal employee insurance, or if you're in the marketplace. We want to make sure that your health plan is covering the telehealth services that you need. And then finally, one thing we've been active in and that we remain committed to is ensuring that treatment decisions and care allocation are being made not based on a person's disability. And the Office of Civil Rights at HHS issued guidelines that said to states, essentially, if you're going to be making care decisions, you can't use whether or not a person has a disability as to how you make those determinations. You can only look at their current sort of state of illness in those grander scheme of things. And that, you know, we were very pleased to see, but going forward, there's definitely still improvements and protections that could be put in place just as this sort of plays out. So that's sort of our overarching advocacy priorities at the federal level. And I can answer any questions you might have about that now. and hope that sort of gives you the lay of land. I will say that the timeline is still very much to be determined. You know, the first pieces of federal, congressional, or federal response were very quick, and that was in part because the emergency was really unfolding. It was also very unusual, the speed at which these bills were passed. We still don't know whether or not the House will return to DC on May 18th. Originally, they were supposed to be back earlier, but it was pushed back and pushed out further. So, you know, the timeline is still very much up in the air, but it's still important to be communicating with your federal members of Congress, your senators, as well as your House representatives, the importance of helping people with autism in the next COVID package.
Absolutely. Thank you, Angela. And those relationships with your legislators may seem like they're not important, but they're so important. And we're going to provide information on a slide later that lets you know how to figure out who your legislator is. If you go to Autism Speaks Advocacy, you can do that. And the Texas delegation is so important. And they need to hear from the autism community. I know you guys have been incredible historically in advocating to your federal delegation. So John Cornyn, Ted Cruz, you know all those folks, they need to hear from you regularly so they understand autism. So we're gonna move on now to state advocacy. Yay, state. Thank you, Angela. And my dog is locked outside the door, so. And I don't know where Jack is right now, so hopefully they will be quiet. We are authentic around here.
It was fine.
Absolutely, I know this whole group, we're authentic. It's all good. I love it. Okay.
Real.
All right, so my home state of Texas, it always warms my heart to talk with my fellow Texans about what's going on. And we actually have been, there's a smaller group of folks who we've been talking regularly, trying to identify different issues. And I will say too that if you listen to this webinar or watch it and you want to get further involved, please reach out to us at advocacy@autismspeaks.org. We do have call-in meetings sometimes with Texas advocates where we talk about what's going on just on a much less formal basis. So just know that that's open and we want to invite others from the autism community, all walks of life, all across the state to be part of it. So as we fell into this new way of being, we decided to try to focus on the 3 areas where people kind of go to try to get support. And so we know that healthcare is a huge issue for people with autism. Angela mentioned HCBS. Those are those home and community-based services, things like the class waiver, where we have 100,000 people on the wait list in Texas. Those services, though, are something that we focused on. And then, of course, always those services that are received through special education and early intervention in Texas. It was challenging before, and it's even more challenging now. So we tried to focus our advocacy, work with the broader community to really make a difference. And for all of you who've been involved so far, I just want to say thank you. People are so busy, you know, as exhibited here, like we're Zooming in, we're working from home. Many of us have autistic family members, and it's just challenging right now. So for those of you who've taken time to advocate, thank you so much. All right, so I'm going to talk quickly about those buckets that I mentioned just then, and I'll try not to bore you too much with too many details. If you do have questions, though, let us know. So first, we'll hit upon healthcare. So many people in Texas, a lot of people in Texas, get their healthcare through Medicaid. And so early on during the pandemic, CMS, which is the federal agency that oversees Medicaid and works with the states, said that the state plans that offer health coverage for people on Medicaid could have some flexibility if they filled out what's called an 1135 waiver. And so Texas did do that, and they were approved for an 1135 emergency waiver. And it does things like it extends pre-authorizations, suspends pre-admission screenings and annual resident reviews for 30 days. It provides some flexibility around state fair hearing request and appeal timelines, and some flexibility around provider enrollment. And in the webinar, you'll see that there's language talking about additional information can be found here. There's a link to the source document. So after we send this out to you, if you really want to geek out with the details, you can go to the link and look at those details. But this kind of provides the broad information about the flexibilities in healthcare that might affect our community that are utilizing Medicaid. All right, and then of course, telehealth, who knew? Before this crisis, my son Jack would not attend to a screen at all. He doesn't like to watch videos or TV or movies really. He'll do movies a little just because he's into the popcorn whole thing, but he's just not a screen guy. And I'm happy to say through this experience, he's learned how to engage with his therapist, speech, ABA, even with his GI doctor via telehealth. And so it's been, I know, life-changing for many of us. For many of us, it's been an exercise in frustration too. So it's hard, but it's so important that this option be made available. So in Texas, the Medicaid and CHIP health plans cover telehealth services. HHSC is encouraging health plans to use this option when responding to COVID-19. We've reached out to the autism community in Texas, to the provider community, and we've heard generally good results about how this has been working. For people who are in those waiver services, again, HCBS, Home and Community-Based Services, they are also being allowed to use telehealth. And I know that's happening with even like the Texas Workforce Commission through Voc Rehab. And I know they are available to provide a great deal of support and have told us to definitely encourage the community to reach out to them. So if you do need some sort of supports and services and you're wondering where you might go, one source might be the Texas Workforce Commission. So think about that. And they are utilizing a telehealth model. And then of course, private health insurance plans are covering telemedicine, and I put the governor's emergency rules, a link to that if you want to look at those. And the advocacy community worked really well together to make sure that that was meaningful for autism treatments and supports and services. And so it's broadly applied for all the variety of services that a person with autism might need during this time. Is it perfect? No. It's definitely, you know, we've been building the airplane as it's taking off kind of thing, but it is available for you, so it's important to know. I would appreciate your feedback, community, about how it has worked as you have time. And then also we've been talking about the need for this temporary availability, should it be made permanent? You know, and so we want to be careful because we want to make sure the option's there, and when medically necessary, you know, that access is opened up. So important for communities and for individuals to have access to supports and services. And if telehealth is the appropriate mechanism, that's what we need to pursue. What we don't want to do is erode any in-person services. We want to make sure those are available to people, and that, you know, the health plans don't try to do something to erode those services if telehealth is made permanent. So I would ask of all of you for your feedback on that as you have time. Just let us know. All right, home and community-based services. We've been talking about this a lot. So this is like the class, the HCS waivers. Many of you are on wait list for this right now. It's like 15 years to get a slot. I do know people who actually access the services. So when the pandemic really started escalating in the United States, CMS again came out and said they were going to allow flexibilities for home and community-based waivers through something called Appendix K, which I'd never heard of, but Angela Lillo knew all about it and told us, hey, we need to make sure that we're moving forward with this in the states. And so Texas got their application in on April 28th, which was just recently. And that's really late too, I will say. Most states did it much earlier. So Texas, I know, is a complicated system and it took them a little while, and they're going through leadership change, of course, too, at HHSC. But anyway, they did get their application in, and CMS is turning those around pretty quickly. So these are the things that they requested. You'll see on the screen. extensions for reassessments and reevaluations, extending appeal and fair hearing timeframes, allowing for remote delivery of certain waiver services. So things like that. Changing the policies around visitors in settings where home and community-based services are provided. They're not allowing visitors in certain situations, as you all know, to protect against infection. So things like that. I did put a link to the Appendix K application if you want to look at it, and we'll be watching closely to see if and when CMS approves it. I suspect they will. I can't guarantee that at all, but they have been approving them. You know, more than 30 states they've approved so far. That number's climbing, and they're doing it quickly. So those flexibilities should be available for Texas waivers in the very near future. Okay, so now let's talk about our favorite thing, special education in Texas, which has been challenging historically, and now it's even more complicated. So TEA actually just came out with some updated FAQs on May 7th. And basically they talk about how free and appropriate public education is still appropriate if services are being provided in any way to regular ed students. But they also talk about how there's not really a defined method. You just have to give it your best effort. And I know that's been very confusing for families. But it is important that families know their rights. They need to know that they can request virtual art meetings, and that timelines are still in place. You still have rights under IDEA, so please don't forget that. Make sure there is a link to the FAQ right there on the page where it says May 7th, 2020 FAQ. So I would encourage you to read through those. If you have questions, let us know. But this is definitely a very challenging time with special education and early intervention. Texas did receive a big chunk of money from the COVID-3 stimulus package through the Education Stabilization Fund. K through 12, Texas got $1.2 billion to invest in K through 12 to help through the time of the pandemic. There is a portion of that that's supposed to be appropriated to students with disabilities. So, you know, there should be some supports and services or remedies provided through that funding. Post-secondary got $1 billion. And then Governor Abbott actually got $295 million to use at his discretion for education in Texas. And so we've been asking that with that discretionary money, particularly, that our governors, including Governor Abbott, think about some priorities like making sure students with autism have access to assistive technology, to Wi-Fi, to hardware, software. So if they're able to, they can engage in distance learning. We want the governor to provide early intervention services appropriately, and if children are aging out of early intervention, ECI, and they're going into special education, that they do so at the appropriate rate of speed. So if they need to put on the brakes and wait, that they do that. We also want to make sure that those services that are not being received now aren't just disregarded. There's a lot of talk, of course, about what compensatory services are going to look like as families make their case when school resumes. We want the governor now to take some of this money, the $295 million, and ensure that that's invested in providing services now. There's no reason why schools can't provide services when things start opening up. They don't have to wait to the new calendar year. They could start providing services on an individual basis to students with autism who have IEPs or 504s. And then we're also very worried about students that are transitioning out. There is some information on the FAQ about that and about how evaluations still need to occur. The transition services still need to occur, and we would like that process to slow if possible so that students who are transitioning out don't get pushed out without the appropriate transition services. So I've talked about many things. I know we're throwing a lot of information at you today. We would ask that you stay in touch with us. You can email us, as I said, at advocacy@autismspeaks.org. You can follow us on Facebook. on Twitter and on Instagram. You can message us on Facebook too, and we'll get back to you just as soon as possible, because the important thing is that we do stay connected with you and that our advocacy is meaningful for Texans. So with that, I will stop all my talking. I don't know if we have any questions. Kelly.
We had a couple of things that got answered in the chat or Q&A box, nothing that is needing to be answered live.
I love it. I love it when the questions get answered in the chat box. Thank you so much. Okay. All right. So now we get to the really good parts. So Colleen is going to join us, and she is going to share resources that Autism Speaks has to share with all of you to support you during this time. So Colleen.
Thanks, Judith.
Without further ado.
Can you hear me?
Yeah.
Perfect. Well, everyone, thank you so much for joining us. I will tell you that I've worked in the autism field for over 30 years and have never experienced anything like this in my life, and I know none of you have either. It's just completely unprecedented, but I did work in the field. I've worked at a therapeutic day school. I've worked in early intervention. I have a background in autism, so I clearly understand the challenges that people are facing every single day. One of the quotes that I really have kind of embraced lately that I've seen floating around is that we're not all in the same boat, but we're all weathering the same storm. And it's so true because everybody's situation is completely different. I will also tell you that I am in Chicago. I am based in Chicago, but Texas is part of my territory, and I've really enjoyed getting to know the community down there. You guys are just wonderful. I was there twice last year for 2 big transition town halls that we hosted in Dallas and Houston, and very much enjoyed getting to know the community during those times. And also with Judith and some of the other Autism Speak staff do attend the weekly autism advocacy calls, which is also very helpful. I want everybody to just be aware, first of all, too, I don't have dogs or children, but I just got a notification that the Blue Angels are flying over in about probably 5 minutes. So you might hear really loud noise outside my window, and it's the Blue Angels. And they're flying over to honor the first responders and healthcare workers, which I think is pretty amazing. So I apologize if that's really loud. I'll stop talking if that starts happening. But one of the things that we did when COVID-19 really first hit our communities was sort of switch gears with a lot of what we were, resources that we're building. And we really try to cater to what is happening at the particular moment. So we sprang into action. We came up with a lot of different resources because we know some of us better than others because we have personal connections or professional connections to autism, how this is really taxing our community. I don't need to tell you, we know that it's hard, that there's disrupted routines. We know that you guys are parents and you're now therapists and teachers at home, and some of you have jobs of your own. So we know that that's really challenging. We also know that adults with autism are experiencing job loss as well, and disruption to their days and disruption to their routines. So we really understand all of that. And I say to people all the time, every day, we might not have the answer for every single thing, but we certainly are here to support you in any way we can. So you can go to the next slide, Judith. So you guys have seen this slide before, and we put it in again to really reiterate that this is a wonderful group of people that you can contact. On your own, you can call them. They're called the Autism Response Team. We refer to them as ART. But ART stands for the Autism Response Team. They're available Monday through Friday, 9 a.m. to 5 p.m., whatever your time zone is. When you call, your call will be routed to the closest person, the closest team member or associate in your region, which is fantastic. We also have dedicated Spanish speaker associates, and they're bilingual and they're fabulous. So you can call 888-AUTISM2, or I spell it out as 888-288-4762. And then the line in Spanish is there at 888-772-9050. We also know a lot of people don't like to, nor do they want to have a conversation. So you can email us at help@autismspeaks.org. I can tell you a little personal shout out to the Autism Response Team because I've been helping them through this really kind of very high traffic, busy time. and they're just incredible people, and they're here to help you. So we have some great resources on our website that are really divided into different sections. So there's one that's dealing with school closures. We have how to handle clinical care right now during social distancing. We also have Facebook and Instagram pages for social media, and they're closed Facebook groups. So for Texas, there's one for Houston, there's one for Dallas and Fort Worth, and there's one for San Antonio and Austin. So please, if you're interested in joining those, do so. Another thing that we are offering right now through collaboration with Ocali is an online video learning resource, free training through the Autism Certification Center. And it's 30+ hours of training that we're providing, again, in collaboration with Ocali. I started to do these, and they're really wonderful modules. So between now and I think May 31st, these are available to you. And they're different topics, different ages, age-appropriate topics. They're really great. So please take advantage of those as well. Next slide. So if you go to autismspeaks.org, the very first thing you'll see is a gold banner that pops up on the main page, and that will link you to all kinds of different resources. You will also see that you can look up information by topic, which is really nice because we've organized the website now so that it's easier to navigate. So if you're looking for information about safety, you're looking for information about behavioral challenges, medical resources, family supports, adults with autism, you can click on each one of these, and then a myriad of resources will open up for you, and a bunch of different articles. We have toolkits that are free downloadable items on our website, and it's just wonderful. So please take advantage of all of our free resources. Next slide. Oh, thank you. But I do want to say, again, I can't stress enough to contact the Autism Response Team. If you have a question, if you have a story you need to share, if you need guidance, if you just need to talk to somebody, we're here for you. So please make sure you utilize that as a resource. And please know how much respect and admiration we have for you as parents, as people with autism, and as professionals working in our community. You guys mean a lot to us. So thanks for joining. And I will turn it back to Judith for any questions if we have time.
Do we have any questions, Kelly?
We do not.
Okay, we're very
You all were totally crystal clear.
Very good. All right. Well, I so appreciate everyone's time today, and we appreciate your involvement. We do want to hear from you if you do have questions, if you have suggestions about advocacy, and we, of course, will continue to share updates with all of you. You can reach us at advocacy@autismspeaks.org. And again, check your inboxes later. We will be sending you a copy of this presentation as well as a recording, so you'll have all the links and the information. We do want to get good information out to the community today and moving forward. So please do stay in touch with all of us. Thanks for joining us today. Take good care.